proliferative phase, secretory phase. On here, this is pregnancy, so don't worry about this one. And that ties in very closely, of course, with a woman's ovarian cycle. Primary follicles, and around here are follicle cells. And probably the best you can do is make this a secondary follicle and a tertiary follicle, and that's pretty distinctive. And so it's marked by the presence of this antrum, larger fluid-filled cavity. And these follicular cells enlarge and become granulosa cells. And here, of course, is the follicle. And that's what's released during ovulation. And so here, some of the follicle cells, those surrounding the follicle itself, will be ejected. And then this will remain. And this will become the corpus luteum and corpus albicans. And so with expansion of the corpus luteum, estrogen levels increase. With the corpus albicans degenerates, estrogen levels decline. And this is what triggers your period. Okay? Okay. But with pregnancy. And so, let's see, primary follicle, secondary follicle-ish, tertiary or mature or graphene follicle, it's all the same thing. And those are surrounded by the granulosa cells. And here's our follicle. And same here. And so this would be the antrum. Don't confuse this with the blastocele. People frequently do. And then here's ovulation, corpus luteum, corpus albicans. Here, of course, is the fallopian tube. Does not come into contact with the woman's ovary. The finger-like projections are fimbriae. If pregnancy occurs, let me step back. If fertilization occurs, very typically, it would occur here in the infundibulum of the fallopian tube. And then it'll be moved along by cilia on the inside and enter the woman's uterus, where you get implantation. Hopefully you get implantation here. What is it called if you get implantation here? And that does happen.
Ectopic.
Ectopic pregnancy. And that calls for an immediate abortion.
Yes. It can be life-threatening.
Yes, it can. So typically it will kill both the fetus and the mother. Here, implantation. So this would be the fundus, and then parametrium, myometrium, endometrium. And here's the fornix, right here. Here's the vagina. Oh, excuse me, this is the cervix, and then the hollows here would be the fornix. Okay, implantation has to occur in the same orientation every time. So the inner cell mass, which is what becomes you guys, must orient towards the endometrial lining. Most of the time it does not. So about 80% of the time, you get incorrect implantation and the pregnancy will terminate before the mother was aware that she was pregnant. Here, you may remember, meiosis doesn't go to completion unless fertilization occurs. And the sperm has to digest its way through here. And so out here, corona radiata and zona pellucida. If fertilization occurs, and I would argue that that is not the same thing as pregnancy, the cells will start to divide asymmetrically, and ultimately you get this solid ball of cells, a morula. Cavity opens up, and blastocele would be here. Amniotic cavity would be here. The rest of this isn't too good. Here is the embryonic disc, endoderm, ectoderm. So the endoderm always faces the blastocele. Okay, here, corona radiata. This white can be considered the chorion. The red here, lacunae, and those will hold, that holds maternal blood. So maternal and fetal blood never mix. Here would be our blastocele in effect. It's the heart, the yolk sac, umbilical cord. Okay? Okay. Here in this model, got the same things, starting with a primary follicle, secondary follicle, tertiary follicle, ovulation, corpus luteum, and corpus albicans. Fertilization occurs, typically it occurs here. It doesn't have to. Corona radiata, and make the darker blue here, zona pellucida. So we literally start out life more or less swimming in beer, which is unfortunate because beer doesn't taste very good. If fertilization occurs, you get some asymmetric division. That is cleavage. Develop a solid ball of cells. This is the morula. It hollows out. This would be the blastocele, and surrounding it is the trophoblast. And here's the inner cell mass that I talked about before. It will eventually lift off the trophoblast, and this is another cavity. This would be the amniotic cavity. So this is endoderm. This would be ectoderm, blastocele. Eventually that becomes filled with the yolk sac. But you know, in placental mammals, the yolk sac doesn't amount to much. And then here, cytotrophoblast is indicated, and syncytiotrophoblast. Okay? Have male and female pronuclei. Here's the morula that I mentioned before. Trophoblast, inner cell mass, blastocele. And the same, trophoblast, inner cell mass, blastocele. Here, let's make this the trophoblast again, although we're starting to see some differentiation. It's blastocele. This would be the ectoderm, endoderm, and amniotic slit. Here, chorion, with all of these little chorionic villi, or chorion frondosum. And this, what do you suppose this is? Good, you know. Here's the chorion, extraembryonic cavity. And then, let's see, here's the blastocele. And so this would be ectoderm, endoderm. And this is actually the amniotic cavity. This is going to expand and eventually fill up the whole embryonic, extraembryonic cavity. Here, you guys remembered what this was, right? Oh, this is actually the maternal component of the placenta. And so this would be the decidual basalis. Chorionic villi, make this the chorion. Here's the yolk sac. So, ectoderm and endoderm. This would be the allantois. And here, that's going to be the developing umbilical cord. Okay? And here we see the same things, umbilical cord, the yolk sac. In placental mammals like you guys, it doesn't amount to much. Here's junior. And let's essentially make this now the amniotic cavity. And it's possible to do an amniocentesis, but that's going to be when it's about 4 months along, something like that. And you guys probably know all about that. Okay? Male and female pronuclei. Here's some polar bodies. And so we can make this the corona radiata, zona pellucida. Fertilization occurs. We get cell division. And let's see, here, blastocele, amniotic cavity, amniotic slit. Excuse me, allantois would be here. Endoderm, ectoderm, extraembryonic cavity, chorionic villi. So here's the chorion, the lacunae that I mentioned before. So this would be the deciduo basalis, and here are the spiral arteries. So these would supply blood here. And so oxygen and nutrient supply is going to be totally by diffusion. You don't get any mixing of maternal and fetal blood. Here, amniotic cavity is right there. Blastocele, endoderm, ectoderm. There's junior. That looks like developing notochord right there. The yolk sac, allantois, chorionic villi, and lacunae. Here's the expanding amniotic cavity. Here's the heart. Extraembryonic cavity would be here. Yolk sac. The umbilical cord is here. Chorionic villi. More or less growing into these pools of blood, these pools of maternal blood. So here, of course, let's see, eye, ear, upper jaw, lower jaw, pharyngeal gill slits. Here are the somites. Here's the heart, forelimb, hind limb, and the tail. Okay?